Our esteemed listeners, we thank you today for tuning or going into our Love for Book YouTube. You can also find this on our website, which is loveforbookworm.com, loveforbookworm.com. But again, thank you for tuning in today. Today is a topic that is a taboo in my community. My people, my culture, my tribe does not like talking about sex. So nobody talked to us about sex until we got married. And most people here just encountered it after they got married and they did not know what to do. And so the older generation, nobody really told them much about the topic and nobody wants to talk about the topic. Now, in the last radio programs, a few text messages came in. And these were all mostly men who said and complained that their women, when they get to the age of 50, are not interested in sex no more. They said, not tonight, honey, not tonight. And so they requested me to handle this topic. So I'll just take a few minutes to talk about this topic. And again, feel free to contact me on 0788 659 702. Or you can come to Love for Book One. We can talk more about this topic. So this will be a brief discussion about sex after the age of 50. I'll also have a slide to talk about issues with sex, problems with the age below 40. What happens? So in this short discussion, we're going to talk about what exactly is decreased libido, what causes it, what can we do about it, and does it also affect the young people, and what are some of the myths surrounding the topic of decreased libido in men and women together. Okay? What is decreased libido? Loss of libido or sex drive is a common problem affecting up to 1 in 5 men and even more women at some point in their life. It's often linked to a professional and personal stress or important life-changing events such as pregnancy, childbirth, menopause, or any other stresses in life. Now, what are the causes? What really makes somebody just lose sex drive? Maybe you've been very active, and then all of a sudden you lost the drive at all. Or now that you are at the age of 50 and above, or 45 and above, and all of a sudden you have no drive. And sometimes you can even be younger, and then all of a sudden you don't have a drive. It is normal to have cycles in life where you have a higher drive, sometimes you are plateaued, sometimes you have no drives. That's just normal. When it's up and down, people are not sexually active every single day, every single night, every single weekend. So it's okay to continue with the curve the way it has always been gone. But if all of a sudden you have absolutely no desire, no drive at all for weeks, for months, and you don't even want anybody to touch you, and then there's a problem that we need to address. Well, the most common thing that usually affects libido is relationships. Okay? Relationship problems are among the most common causes of loss of libido. Okay? Two things happen here. Okay? Two things happen with sex drive when it comes to relationships. It's either there is a problem in your relationship, or where you don't have libido, you don't even have the drive, you're not even gonna begin to do it, or you have a performance issue. So you are ready to do it, you are ready for the endeavor, you are ready for a beautiful night, but actually you cannot perform. Okay? So the thing is, the first thing you should consider is whether you are happy in your relationship. Do you have any issues with your relationship? Do you have issues with desire in the first place? Let's say you are husband and wife. You loved each other, you courted well, you are married, you've been living together. Long-term relationship. Sometimes being over familiar with your partner and you feel a degree of erotic dissatisfaction. You are no longer interested just because you've lived together for a long time. And these can be issues, or this can bring relational issues or a decreased libido, where you're just so used to each other, nobody gets the other one aroused or interested. So for women, it's totally different. They have to be prepared. They have to feel those cues from the man. Men can just see you and immediately their brains work, they're erected, they're ready for sex. Women on the other side, they have a situation where they have to feel those cues, start preparing their emotions before they are fully into it. Men can fall into anything anytime. That is why sometimes you find weird situations where you find this man all of a sudden has children with somebody in the street who is totally homeless, um, physically disabled, and maybe they just did it right because their brains work differently. It's not easy for a woman to be found to have children with somebody just in the streets and lame and having nothing. So that can tell you a little bit of how women's brain work versus how men's brain work. I'm hoping that I didn't offend anybody in this particular topic. So, so, so there's a relationship where you actually have no desire at all, versus there's a situation where you're ready to perform, but you can't perform because either the guy has erectile dysfunction, cannot erect, or the erection cannot last, or the woman has what we call vaginismus, or pain with penetration. The muscles tense up and absolutely has nothing and has no desire for it. So let's talk about relationships and think about relationship. So if you have a problem with decreased libido, either for you, the man, or on your wife, look at your relationship. Do we have a problem where your relationship is not together? Is your wife no longer interested in you because she has heard that you cheated and you went with other women, or you've married another wife and now this first wife is no longer interested at all, or um, you're thinking your wife cheated on you, and now when you just look at them, you look at that jealous comes in, and you look at them that they are dirty, they are already contaminated, and you have no relationship at all. So let's look at ourselves and let's look at some of the accusations or some of the things that have affected our relationships enough that we have no interest for each other. Okay. Another issue is the stress, anxiety, exhaustion, psychological issues that come about. You know, when you have been married for a long time, you have children who go to school, you are paying school fees, you have to plow the land, you have so many other financial constraints, you have other constraints related to work, and this can consume your life enough that you may not even be having enough time to sleep and rest. And so sex comes to, it's the last thing in the bucket even to think about because of all that. So that impacts your libido and impacts the libido of your partner. If everybody is extremely busy until you all fall down dead and ready to sleep. And so this is a time that you may need to talk to somebody, or you may need to talk together and fall back and think, is this a good thing to do? Should we continue like this, or should we change? Depression is very different from simply feeling unhappy. When we talk about psychological issues like depression and anxiety, so we sometimes think, depression is just something easy, but no. Depression is very different from simply feeling unhappy, miserable, or fed up for a short while. It's a serious illness where you may have feelings of extreme sadness that can last for a long time. These feelings are severe enough to interfere with your daily life and even your sex life. You are probably depressed if you are feeling low or hopeless, or you've lost interest or pleasure in doing the things that you normally would have enjoyed to do. And so with this, you may need to see somebody. This is a topic that actually in the next few weeks, I would love to address depression and anxiety or any other psychological issues within our community. Another thing is drugs. When you are actually drinking a lot of alcohol, or you're taking a lot of medicine, or you're doing a lot of smoking, all these impact your sex life. Okay, so drugs for depression, drugs for some of the drugs for hypertension can actually decrease your sex desire. Okay, so let's imagine you have been depressed for a long time. Now you're taking Lexapro, you are taking a Prozac, whatever it is that you're taking. This research has shown that some of these medicines can impact your sex life, and so can cause decreased libido or erectile dysfunction in that matter for the men. Okay. Now, smoking has a big effect. Smoking actually impacts your whole body. It affects your arteries, your veins, the whole system, and so your circulation system. And we know now, with all the research that we have, is that the penis is not a muscle, okay? And because it's not a muscle, it's a spongy substance that gets a lot of blood supply for it to be erect. And so smoking affects it big time. So if you smoke a lot and you've smoked for years, there's a chance that your libido has actually been decreased because of that. So something to think about. Another thing is even getting older, menopause. Okay, menopause is a big one because these women, when they get to menopause, and menopause is when you have stopped your period for about a year or so. So you've not had a period for about a year. And before you stop your period completely for a year, you've had premenopausal symptoms. Vaginal dryness, pain with penetration, reduced elasticity, what we call ectopic vaginitis, decreased lubrication, hot flashes, night sweats. And I know that a lot of women suffer from these issues, but they don't know that they could actually have some remedies or some ways to improve or decrease the symptoms. That way they can improve their quality of life. So at menopause, women go through a lot. There's a lot of hormonal changes that may need to be addressed at some point. And so this affects your sex life. Doesn't mean that when you get to menopause, you should stop having sex altogether. And now you force your husband to either run around cheating or run around looking for another wife. Even if they're a pastor, you put them in a dilemma that they have to look for somebody. So if you get to this situation where you are at menopause, everything is drying up, everything is contracting together, there is pain, there is itching, there is dryness, there are several things that can be done to help you so that you can enjoy your life or at least support your husband during this time. Okay. Several illnesses can also affect your libido or sex drive. If you have diabetes, things like heart disease, if you can't climb a hill because you have heart disease, definitely you cannot enjoy your sexual life. If you have HIV, that affects your brain very badly. And several other medical issues like even hypertension. Sometimes when you are performing or doing such things that excite you, your blood pressure could go up or your heart rate could go up. And so several illnesses can actually impact your sex drive. And so it's important to know what's happening. Now, another issue is contraception. Research has actually shown that women who are on contraceptives have decreased libido, and several of them have been linked. The problem has been linked to contraception, and we'll talk about that shortly towards the end. And I could also maybe create a whole different one, PowerPoint regarding that. So what do we do? How can we improve this? We know that relationship is a big one. Improve your relationship. Communication is the biggest thing. The tongue, how you speak, how you communicate, the tone of your voice, the posture of your body. Verbal and non-verbal communication can actually change a lot in your daily relationship, daily communication, including your sexual life. So a husband and wife, boyfriend and girlfriend, the piece of communication, how you communicate together, your relationship, bonding together can affect your sexual life. So if you are at the age of 50 and above or 45 and above, there are issues with hormones. And research has actually shown that several men above the age of 50 suffer from erectile dysfunction. A good percentage suffer from erectile dysfunction, or a situation where they can either not get it up at all, or when it gets up, they cannot sustain it at all. And so this is something that you need to get tested. Test your testosterone levels. You know, the two things that are the two main hormones that actually affect sex drive, testosterone and estrogen. So what you need to do is get tested for the men. Test your testosterone level. A testosterone level below 450 can actually cause erectile, decrease the libido, and testosterone level below 230 can actually cause erectile dysfunction. So, and we have medications that can actually help you boost your testosterone levels. You know, testosterone, when men have low testosterone, they can just end up being depressed because their physique, their strength, their emotions, everything within them changes. Not just their sex life, but the whole emotional life can change. So get your testosterone checked, and then that could actually help. And for the women, again, testosterone and estradiol are the major hormones that play into this. We have creams, vaginal creams. So we could treat this in two different ways. So the vaginal creams will actually help with the dryness, with elasticity, painful penetration, but may not affect the systemic effect where you need these hormones within your body. So we could do two things. We could also give you the patch, the estradiol patch, or the cream that is topical, versus giving you either vaginal suppository or just the cream for the vaginal area, and that can really help in all areas. We also have the DHEA creams that can help with that area. So you need to talk to your doctor. Visit your doctor, talk to them about what you're feeling, and a good doctor who has studied much about this topic will be able to address whether it's a relational issue, if it's a depression or psychological issue, or if it's a hormonal issue. And if it's a hormonal issue, then you need somebody who can actually test and balance out your hormones so you can feel. So I want you to know that getting to the age of 50 is not the end of your life or enjoyable life, that to say the least. So I want you to enjoy your life. I want you to enjoy your relationship with your husband or your wife or your girlfriend for this matter. So try to do everything possible that you can to enjoy life. We don't rehearse life. We live life once, okay? Avoid the drugs that may affect your libido, and decrease the amount of alcohol you drink. And if you can, quit smoking to be able to overcome this. Now, what about the young population? Actually, that is my mother-in-law. What happens? Research shows that 10 to 30% are on the lowest side, 1 in 10 girls suffer from decreased libido. So we have 10 to 30% of the younger population, 18 to 44, having decreased libido. Why? The biggest thing is hormones for the girls. Most of the girls are using birth control, and that decreases their libido big time. We also have the issue of lifestyle issues, a lot of stress, obesity, alcohol, drugs. Our children are not living the lives we live. They're living a total. This Gen Z generation are stressed out for whatever reason it is. They're more stressed than we were when we didn't have anything. And so that affects their lifestyles. And for the boys, pornography is the worst. Okay, so the pornography has shown that people who watch pornography a lot cannot get to their maximum level of sex drive. So with this, I want you to think about other things and that you can text me and we can talk about. One myth I wanted to talk about and finalize is a penile size. Some people say some people have big penises, some people have very small ones. Now, it's very hard for us actually to say the shoe size is what determines how big a penis is, or how big the fingers are determines. Research has shown that that is absolutely not true. We have two different sizes. So we have the showers where somebody's penis is big, even from when they're dressed, when they walk, when they sit, you can see it big. We call those ones showers. That is the way it is. And when it grows during stimulation, it doesn't go too far from where it is. And we have people who we call growers. So for the growers, completely nothing. You feel it, you don't see it, it doesn't protrude anywhere. But when it gets stimulated, it actually grows. So do not be fooled with the size when you look at it, when it's not erected, because when it is erected, we have again show us that the size is not too far from where it is when it gets excited and we have growers where the size from the resting position to the size where it grows to is totally different. So don't be lied to. If you have any questions, again, feel free to contact us. Again, I want to end by saying you can get care at L4BH, screening at L4BH, and then medications too at L4BH. If you have any questions, please schedule and come see us. We'll be happy to discuss more on this topic. Yes, you are so very welcome.